Hi there, you're welcome to DemiRx Care channel where we talk about medications and how to use them properly. If this is your first time on our channel, make sure you hit that like and subscribe button down below. That way you can get alerts anytime we post our other educating videos and content here on our YouTube channel. Also, as a subscription gift to you, we would like for you to download a free meal recipe that we do have here at DemiRx Care. So go ahead and click on the link down below in order to be able to download or view that. Thank you so much for watching and stay tuned. What are we talking about today? So the condition we're talking about today is known as G6PD deficiency. So what is G6PD deficiency? So this is an inherited genetic disorder. So it's also known as an X-linked genetic disorder that affects the red blood cells in the body. So usually the red blood cells are in charge of carrying oxygen from the lung to other tissue or other areas of the body. And usually when there's something wrong with these red blood cells that are carrying the tissue, then it kind of have a way of affecting other areas of the body, because the blood is the red blood cells, or the blood is the one that actually carries nutrients to different areas of the body. So if there's something wrong with some component of the blood, then it kind of affects the amount of nutrient or the kind of nutrient that those areas of our body does get. So usually what happens in patients who have G6PD deficiency is that there's a defect in an enzyme that is called the glucose 6-phosphate dehydrogenase that causes that red blood cells to rapidly break down prematurely. So in these patients, they're not able to, hold that red blood cells long enough, and it just kind of rapidly breaks down, and it's not able to take the right amount of blood flow to those organs and tissues in our body. So in these patients, they get symptoms such as fever, patients get paleness or fatigue. Some patients get dark or yellow, orangish urine, as well as yellowing of the skin. Or patients may also experience some shortness of breath, rapid heartbeat or heart rate, as well as dizziness in these patients. So what do you want to know about this G6PD deficiency? So usually in patients that are much younger, this condition can actually be very life-threatening for these patients. So definitely you want to make sure that you're taking care of your children if they do have that G6PD deficiency, making sure you're watching what they eat. Usually we want to avoid the children from eating certain type of foods, as this deficiency doesn't have a cure. You just have to avoid triggers. So the trigger food would be like all type of beans. So you want to make sure that you're avoiding, all type of beans if possible. Also making sure that you're avoiding red wine, as well as blueberries, any soya products, as well as tonic water and camphor in your food. So making sure that you're avoiding these food triggers can help go a long way in order to prevent this red blood cell premature breakdown in these patients. So other than food, there are also certain drugs that can actually cause that rapid breakdown or speed up that rapid breakdown in patients with G6PD deficiency. And these drugs would be anti-malaria drugs such as mefloquine or chloroquine. Usually other drugs such as non-steroidal anti-inflammatory drugs such as your ibuprofen, naproxen. These are a sample of drugs that can actually trigger that premature red blood cell breakdown as well in patients who do have the G6PD deficiency. Also, aspirin can trigger that G6PD deficiency and causes that premature breakdown, as well as drugs that contain sulfa, such as your Bactrim antibiotics, such as your macrobid or quinolones. Those are kind of drugs that can precipitate or kind of cause that red blood cell from breaking down prematurely, or cause that red blood cell. They can actually cause that red blood cell to break down prematurely faster than normal. All right, so this condition is actually most common in African patients or patients of African descent, and it's also more common in men than women. So usually this G6PD enzyme is diagnosed by checking the patient's G6PD enzyme level in the blood, and if it's lower than normal, then the patient will be diagnosed with the G6PD deficiency. All right, as I said earlier, this condition doesn't have a cure, so you want to just make sure that you're avoiding any triggers or avoiding foods or drugs that can cause that G6PD deficiency triggering, which will actually cause the red blood cell to break down more rapidly than normal. All right, thank you for watching, and I hope you were able to enjoy this video. Make sure you give it a like and thumbs up, as well as subscribe to our channel if you want to get more alerts when we post our other